of a public role overarching with a heterogeneous private sector must inform the course of the future government-led healthcare in the country. So more intensive utilization of existing rural health facilities is important. Infrastructure, assistance with mobile health solutions, which I have called hospitals on wheels. My suggested business model for Nigeria's hospital to achieve Vision 2015 to 2020 runs thus, and government and private investors will participate in funding hospital infrastructure to be run with a business model, avoiding majority shareholding by government. So government will become essentially an investor and regulator of healthcare. The board of trustees will then be put in place by the investors. This BOT will appoint a management team with a CEO answerable to the BOT. The management team that is then constituted will be made up of trained hospital administrators and professional managed care practitioners. And the universities must open up avenue for academic areas in this endeavor so that we will have a huge resource of manpower that we can harness from. Now, what will the management team be doing? They will provide all the logistics for ensuring a seamlessly functional hospital. They will supervise provision of all aspects of the healthcare infrastructure with the BOT oversight. They will manage the hospital facilities. They will source, provide an oversight with the powers to negotiate terms of employment and hire and fire. Like His Excellency Atiku said, that we have no business having a uniform salary for all workers across the country. That will not just work. All cadre of support manpower will be employed and supervised by this management team. All healthcare professionals like nurses, pharmacists, lab attendants, these can be full-time staff or hired through employment agencies who have proficiency with sourcing, accrediting, and pulling such staff. Now, resident doctors who must be full-time staff for the period of their training alone. The management team working with the BOT will source, provide an oversight with powers to negotiate terms of employment and hire and fire medical doctors who are consultants and specialist medical doctors who should concern themselves with service delivery, clinical and training to the number of hospitals they are offering their consulting services to. This way, all healthcare professionals will have their job descriptions clearly spelled out, audits conducted regularly to ensure services are delivered without any friction. Salaries should not be nationally uniform, but left for each hospital management to negotiate with the particular staff based on their competencies and what they are bringing to the table. It is left for the hospitals to hire and fire staff according to their existing conditions of service, which should be clearly articulated to each staff. Now, in America, there is a Nigerian radiologist, and he tells me that his hospital so values him that when he is on call, they have a chef on ground to take his orders, and that almost every time he will order salmon. It doesn't matter if he orders salmon or he orders caviar. It's given to him because he's so important to them that they don't want him to be poached by others. That is where we ought to be heading to. Now, casualty staff should be employed separately, and that's the staff that deliver emergencies. A critical staff of urgent care healthcare providers should be immediately trained to deliver critical care to the patients in the emergency room. Fully equipped ambulance services should be set up, including air ambulance and helipad for centers of excellence and personal protective equipment. Now, in the ambulances will have publicized, the ambulance service will have publicized emergency numbers, and citizens of the country made to store what we call the ICE numbers, meaning in case of emergency, on their phones, so that if you are involved in a motor accident, just by dialing ICE, they will know who to contact in case of an emergency. They will know your blood group. They will know your genotype or any other important disease or drug reaction history. Mobile health care delivery services, doctor service on wheels, hospitals on wheels, mobile screening service should be changed into a network with all the 3 tiers of healthcare, tertiary, secondary, and primary care all over the country. They should also be prepared to handle mass casualty and their emergencies like the Ebola crisis with pre-packaged crash cards and due diligence with regular rostered drills and rehearsals. A lot of times we have fire extinguishers. How many times have we tried to do drills and rehearsals to know how they are utilized? We like to do fire brigade efforts. So again, public policies should be enacted to seamlessly and efficiently network these primary care centers. Urgent care centers, these are things we don't have. We always depend on hospitals to run emergency care. Emergency care is not only run by hospitals. Specialized emergency care centers exist and should abound all over the country and work with the hospitals on wheels. And they should be made priority developments that should be supported with IFC, Bank of Industry, World Bank funds to exist and flourish in Nigeria. There is indeed a Nigerian in America that is running like 5 of such services across the nation in the US. Now, we need to restructure the relationship of colleges of medicine and tertiary hospitals. The tertiary hospitals should look at themselves as a service provider, and therefore the colleges of medicine need to subscribe to utilize their facility, and they should charge a fee for that, which should be, of course, translated back into the university system. There is also need to outsource some of the hospital services. And again, I want to allude to this Center of Excellence that His Excellency has set up on the diagnostics and renal dialysis. Because if you try to set up similar efforts, it will be backbreaking. So centralized facilities should be available, and the hospitals should be willing to outsource to these centralized facilities. And such facilities are central laboratories, central pharmacies, and central diagnostic radiological services. If the hospital is big enough, it can have its own radiological facility. But definitely for the labs, for the laundry, for the works and the maintenance, this should be outsourced. A unit should be created within the standard organization of Nigeria, because one of the things is a low maintenance attitude. We do not have a good maintenance culture. So if you come to the hospitals, you buy something today, tomorrow, because of a misuse, it's all dilapidated. It's as if you've done nothing. Now, to avoid this, and of course in a structure that is operating under a business model, this of course will be wiped out. However, there is a process to arrive there. And in that interim, we need to have some kind of regulator looking into everything that needs to be utilized in a hospital, such as toilet bowls with their flushing system, bathtub showers, woodworks. This is imperative to ultimately being able to enforce a maintenance structure, a culture referred to. So there are some types of floors that are amenable to be disinfected. So if you put the wrong floor in the hospitals, it cannot be cleaned adequately, and it will be a source for reinfection.